Okay, so this is the first practice case, and this is the first part of the question as well. So I'll give you a few minutes to read through it and to list your answers in the text box. The case is for a 6-month-old girl brought to see by her mother with a 3-day history of coryza and wheeze. And coryza meaning snotty nose, mucousy discharge, that sort of thing. And you diagnose viral bronchiolitis. The first question was to list 3 factors that increase the risk of an infant developing severe bronchiolitis. And the second question is to list 5 features on examination that would allow you to assess the severity of her illness. So be very, I guess, careful to read, first of all, the key features in the clinical stem, but then also to read the instructions or the question very, very closely. And I think this is the 3rd or 4th time I've said it, but make sure you do list only the amount of answers that they want, not more. And if you can think of enough answers, then give the exact number. So you can, if it asks you to list 5, you can list 4, but obviously listing 4 will not give you the full marks. Having said that, if they do ask you for, say, 3 or 4 answers, there can be potentially 5 or 6 correct answers. Some may be weighted more heavily than others, and some may be critical answers that you cannot miss to be able to get full marks. Okay, so this is the answers for both question 1 and 2. So again, just to remind you of question 1, it was basically to list 3 factors increase the risk of developing severe bronchiolitis. So key features, you want 3 factors and 3 factors only. So those of you who put 4 factors or more would lose marks because you put too many answers. Weren't being, I guess, as succinct enough or as targeted or as focused with your answers as they would have liked. Make sure that you also realise that the question is asking you about severe bronchiolitis as well. So there are very specific risk factors for that. But as you can see, based on the answers, each of the risk factors are of equal value, so of 1 mark each. So if you had any of these as separate answers, then you would have scored 3 out of 3. The chronic respiratory disease, some people had put down CF, and that would be very appropriate. Chronic lung disease, yep. Prematurity is also a strong one. Congenital heart disease, and those infants who are particularly young. A lot of people put family history of asthma. That, according to my source in terms of the Royal Children's Hospital as well as the New South Wales health guidelines, is not classed as a risk factor for severe bronchiolitis, nor is smoking in the family. It may certainly be valid, but I guess in terms of the what they're looking for, you need to give them their specific answers. That'll be the same in the actual exam as well. So once they sit down to mark the examination, if a lot of candidates put down a lot of people put down a very sensible and very appropriate answer, and it was as an answer that they hadn't put down in their initial list, then they would actually mark it accordingly and perhaps include that additional answer as part of the marking as part of the answer sheet. So if a lot of people put it and it's quite appropriate, then it should be okay as well. In terms of the second part of the question, it was in regards to 5 features on examination that would allow you to assess the severity. So as an example, put down these features of the examination, and if you can see the increased work of breathing is allocated 2 marks. So if you hadn't put that as part of your 5, then you would have lost 1 mark. But the rest were all worth 1 mark. In terms of some questions, we might go through that at the end of the second case as well. So we'll just move on now to the second case.